Hello, my name is Dr. B. Shah. I'm one of the directors of Medlighten Medical Education. Now, in today's video, I want to talk about negotiation skills, and we're going to cover two examples that might come up in your medical exams. Example 1, a patient with acute anxiety asking for diazepam. Example 2, a patient with epilepsy who refuses to stop driving. In both of these scenarios, there's 3 steps to follow to have a good conversation. Step 1, acknowledge the patient's perspective and find common ground. Step 2, explain why what the patient wants is a bad idea. Step 3, give a plan B and explain why your plan B is a better idea. Now, the reason we start by acknowledging the patient's perspective is because unless you show you've listened to the patient, there is no reason why they should listen to you. So if we use the diazepam example, imagine you have Mrs. Smith, 45, with severe anxiety, who's asking for another prescription of diazepam. She had one last week. This is what I would say to her. I would say, Mrs. Smith, you're absolutely right that diazepam is a very effective medication for anxiety, and it does work fairly quickly. But the difficulty is, I'm not sure if you're aware, but it can lose its effectiveness with time, and it can become addictive. Now, there's another medication called propranolol, which also works fairly quickly, but it doesn't lose its effectiveness with time, and it's not addictive. A lot of our patients have found it really helpful when they're feeling as anxious as you are. I mean, is it something you'd be willing to try? And as well as the 3 principles, acknowledging her perspective, explaining why what she wants is a bad idea, and giving a plan B, I've also said that a lot of our patients have found it very effective. And if that is true, that's a good strategy to use, because if you're to book a course, for example, if you choose to book our course, you would book it after reading recommendations or reviews from others, or you would book it because your friend has recommended it. In the same way, if you suggest a treatment to a patient, they're more likely to consider it if they know that it's been helpful to other patients. So let's take the second example, the epilepsy case. Imagine the patient works as a driver. I would say, Mr. Smith, I can't imagine how difficult it must be that we're suggesting that you need to stop driving, especially when you need your car for work. And I'm really sorry that we're asking you to stop driving, because I can only imagine how stressful this must feel. However, my concern would be that if you were to drive and you were to have a seizure whilst driving, you could end up in an accident, and it could put you or other road users at risk, and it could also invalidate your insurance. So I'm just wondering, if you were to stop driving, first of all, I could give you a sick note or an amended duties note. So an amended duties note would be asking your employer whether it's possible for you to work from home. The other option would be, I don't know if you've heard of the government's Access to Work service, but sometimes they can fund the cost of taxis to and from work, so that might be an option. And thirdly, if you're not able to drive, you would be entitled to a free bus pass, which might make things a bit easier. What do you think? So again, I've acknowledged the perspective, I've shown empathy for his situation, then I've explained why driving's a very bad idea, and then I've offered alternative ways that he could get to work. And then I've said, what are your thoughts? Because I want to make sure he's involved in this decision. Of course, ultimately, if he refuses, I would have to tell the DVLA, but my aim would be to get him to agree. So the 3 principles of negotiation: acknowledge the patient's perspective, explain why what they want is a bad idea, and 3, offer a plan B and explain why that plan B is a better idea. I hope that was helpful.